Welcome, listeners, to our fourth and penultimate episode of our second season. I'm Rohit Sehgal, Chief Strategist here at the Voices Project, based out of Singapore. Our objective in this season's episodes has been to lay the foundations for a deeper, more regionalized understanding of the necessary frameworks for the role of tech in life sciences. By doing so, we aim to develop region-specific consensus that can be leveraged by policymakers, healthcare professionals, and actors in the private sector to better facilitate and, one should say, accelerate the development and rollout of much needed innovation and reform. Not only in Asia, but one should take a more globalized look at this as well. And it's really trying to develop the necessary coalitions and collaborations amongst those vital voices, the policymakers and agenda setters, that can complement and build upon existing initiatives. In this keynote episode, I'm joined once more by the always irrepressible Dr. Kiran Priyadarshini, JPAC Lead for Health and Life Sciences, Microsoft. Kiran, for those listeners who've not tuned in to our previous episodes, would you like to give a little bit of a background to yourself?
Yeah, thank you so much, Rohit, for once again inviting. Always the elixir of live speaking with you. So just as a matter of introduction, I lead the healthcare vertical at Microsoft for JPAC. And what that means is being able to share the technologies that Microsoft brings for empowering healthcare organizations, be they hospitals or providers or payers across the multiple countries.
Thanks for that. Well, we've had tremendous discussions in the last, I would say, almost 3 episodes with some very engaging guests, including Kiran. And I'd urge our listeners to definitely give those a listen. From the factors and gaps in health and tech policy making to the risks and rewards of personalized healthcare and the fundamental role that consumerized health can have in defining newer age treatment access. And one of those always omnipresent issues, adherence and compliance. What we want to do in this wrap-up episode, one can say, is to reflect on some key takeaways and try to help frame the pressing future aspects of technology-led healthcare. And it's important that we have someone like Kiran here because what Kiran's doing is reflecting it from the point of view of technology neutrality and looking at it from a much more broader perspective, which really does lack in the discourse that we have in our industries today. Right, so Kiran, I'm going to give a very perhaps somewhat obscure reference. So for our listeners as well, please forgive me. But as a kid growing up in Kuala Lumpur, one of my favorite TV shows was The Jetsons. Now, for those who have not seen The Jetsons, it's still available. You can still catch it online. It's actually one of those lovely 60s cartoons that used to sort of look at the future and how the future was going to be, sort of in the same realm of where the Flintstones used to be. Interestingly enough, I learned this only recently. It's supposed to be set in 2062. And that's not so far away now. And some of the visuals in that TV show used to show some amazing things, using that reference, it seems we're living in the future sometimes, doesn't it? With data convergence and health convergence. The world of wearables in particular has redefined much of our lives. So imagine, Kiran, if you had a crystal ball right there in front of you right now, how would you define particularly this role of wearables or this next chapter of healthcare from that perspective of how it's bringing patients, health service, all that together? What does your crystal ball say?
So Rohit, would love to have the 2062 today. But what my take is that we've just begun the journey, right? And I think one of the silver lining around COVID has been that it has accelerated some of that journey. But I would say we're just at the start. But going forward, I think there are 2 things that we would definitely see very positive happening. One, as you rightly said, data convergence, or what we call as interoperability, where you're not looking at siloed data sets, but you're looking at an interconnected where everybody talks to the other. It's just like your Bluetooth speakers. They talk to every device that you want to connect with them. Healthcare is going to be like that, where it's a plug and play kind of a system that depending on which device or which, let's say, service is generating data, you're able to kind of integrate that into the main hub. So these are going to be spokes which are going to kind of feed into the main hub. And that is something, it's just that the spoke and the hub could be defined in different ways. It could be a group of hospitals with their subsidiary across different geos, or it could be the government. The government could have like a national hub, and every hospital, public, private, pharmaceuticals, pharmacies, payers kind of dipping in and uploading their data into that. But there's going to be convergence for sure. And data and AI are going to be the drivers for that convergence. That is one thing that I think will definitely be much better than where we are today. The second one is therefore the types of data, right? So if you go back like 15 years ago, or even let's say 10 years ago, most of the data was your medical records. But that's not the conversation we are having today. And it's going to get, even more stronger, where we're saying data can come in from different sources. Even with what we are talking now, this is what we call as an unstructured data, where we're having an open conversation. Even that is going to have a role to play. So what I would say is the quality, the type, and the quantity of data is going to be on the rise. And wearables is definitely one of the data, right? So you're going to have medical data, you're going to have omics, what we call as omics data, you're going to have DICOM images. In healthcare specifically, you're going to have lab reports and wearable data, right? So wearable data is going to be, as I said, much more continuous, higher in quantity and quality as well. And so coming back to the hub and spoke model, you're going to have what we call as APIs, or these connectors, which have the ability to pull in that data into that national grid. So this is where, the freedom to generate data, and this wearable data would have very clean objectives. One is prevention, right? And that's why we're saying, given a particular profile of a set of population, how do we prevent them from becoming sick? Number one. Number two, those who are already sick, how do we kind of keep the quality of life going, right? How do we kind of maintain the disease should not progress, but we're able to regress the progression of that disease. That's the middle segment that I see, the fat segment, right? And then the last one is where we're looking at wellness. This is where we are saying, hey, you don't have any disease, you're not sick, you're healthy, happy, and strong. How do we keep that right into your 80s, your 90s? And I think by 2062, all of us would probably be in our 70s, 80s, and 90s. So how do we keep that really well so that people enjoy that quality of life? So I think these are the two things that I see going forward, which we will do very well: data convergence, national hub, different types of data. And there again, you will have technology coming in to say, how do we make it seamless? How do we make it, secure? Because data has to be secure and private. At the same time, what are some of the new cool things that we can bring in to help the doctors, achieve patient outcomes? So those, I think, would be the interesting parts going forward.
Thank you. I mean, that's a good segue to sort of talking about the 800-pound gorilla in the room, which is always present. And it's always that about data privacy, isn't it?
Yeah.
We're talking about such a wide array, or an opportunity to spread technology from different parts of health services and health providers. It's always been something with naysayers that, whoa, data privacy, and, how is that going to happen? And we've touched upon that in some of our earlier episodes specifically. Have there been, Karen, mitigating factors that can provide some sort of assurance that data privacy or security and greater efficiencies outcomes are now actually possible? It's almost, is there such a degree of barrier to data privacy then, or is this more just a legacy? What would be some thoughts there?
Yeah, I think there are two steps to that, Rohit. So the first thing is classifying data, because, we treat all data as equal in healthcare, and that's not true, because healthcare data, as I said previously, will come in different forms, different sources. All the data does not have to be treated with the same sensitivity, same level of privacy as well. So I think data classification based on each country's, definition is, I think, the first step, right? And then comes, of course, depending on the level of sensitivity, how much of privacy and security you need for this type of data. And that's where technology comes in. And just to name a few, I was in a seminar conducted by Zuelig Pharma a few weeks ago, and shared it on LinkedIn as well. That's where we were talking of blockchain. And with cryptocurrency coming in, how can we keep data secure? How can we track who is making those changes in that data? And how do we kind of have by invitation only, so that, there is, the patient can decide who should have access to that data, right? So that's one type of technology that's evolving. And thanks to, of course, things like cryptocurrency, it's kind of evolving faster. Then you have in healthcare what is the fast healthcare interoperability resources, right? FHIR. Now that is very interesting, because that's where we're saying, how can we kind of bring all these data sets together? And when we move to the cloud, we, at least with Azure, we have capabilities where we can anonymize that data, right? We have Azure Health Data Services where we're able to anonymize that, and whatever, let's say, insights we want to draw is on totally de-identified data. So when the data comes back to the hospital, is re-identified. In that way, you keep that data very private. But at the same time, you're able to do the analytics that you want to do. Again, to serve the same population, right? How do you kind of help the doctor have better patient outcomes? Yesterday, I was with one of our clients, and they were saying, oh, if I'm doing a teleconsult, and that was under a trauma condition that, they're doing a teleconsult, can I get all this data together in one place and make sense of it? Now, that's where we're saying, how can we keep that data private? Because, we should know who accesses it, who should have access to that, and what access should they have. So these are some very interesting capabilities that we have at Microsoft as well, where you can, and we use it in our daily life when we work at Microsoft. So technology is definitely there to ensure that you're able to use that data, but at the same time, keep it secure and compliant.
Yeah, I mean, it's funny because there have been times from a regulatory perspective when it came to, I think, the early days, just as the pandemic was coming in and telehealth was suddenly, having to fill the sort of some gaps, that what sort of information are you imparting in a less formal environment, and who is able to see it needs to also be factored in. So it's not so much about the more virtual ether data, but also sometimes the sheer data that's being shown on screens or discussed in environments that aren't perhaps as secure as they should be. So there's a whole sort of factor. I remember someone sort of pointing out that I think it was an eye doctor somewhere in India who was trying to look at the patient through a laptop or a phone. And the lighting was poor, and the person had to put their camera phone on, but more than that, it was trying to explain certain sensitive issues that the family members were nearby, and this person said, I didn't want them to know all that. So you take that one notch higher to infectious diseases or sexually transmitted infections, and being told your diagnosis in places where data is not so private. It's an interesting dichotomy that, it's about how do you have an all-encompassing, I think, as you're saying, an all-encompassing view of where data and technology can reside.
Yeah, so if you look at that same example, right? So what you can do is what we're doing, on Teams, what you can do is doctors in major public hospitals are using that. When they go around the wards, and especially nurses, right? They're handing over to the next nurse, and they suddenly see that this particular patient has some lesion or some injury, and they want to hand it over to the next nurse, but also take a record that this is what we saw, and this needs to be treated. So using Teams, you can take a picture. It will never leave. You cannot download it onto your phone and then circulate it through other means. No, it will remain within Teams. Only those who have access will be able to even look at it, right? But at the same time, there is a very good handover, because that nurse X is handing over to nurse Y. And if I were to stretch that logic a bit more, we have AI models, right? And this example that you shared, the person doesn't even have to detail a lot, because this picture of the eye would be subject, and we have some very interesting models in India as well, where using AI, you can actually kind of see what are some of the issues that even the patient doesn't know, and it can kind of bring the doctor's attention to these anomalies in that image and say, you might want to do a deep dive into those. So that's the interesting part, where you can really bring in technology and keep the patient didn't have to kind of give a full detail, but keep that image safe, very, very between the doctor and the patient only.
Yeah, absolutely. Well, one area that we should be talking about, and I think for our listeners who are in hospitalized care, or at least from an administrative point of view, and I'm sure this sort of plagues you all very often. So that's about sustainability goals. Now, let's sort of contextualize this. I think the general population always looks at the usual suspects for carbon footprints, whether that's transportation, factories, mining, industries, and so on. Not many people realize that when you look at healthcare as a polluter, it's something that actually has been a big issue. Now we sort of break that down. Hospitalized care does pollute. I mean, everything from lighting, electricity, the laundry, the surgeries, disposing of biohazardous wastes. Many countries still use fairly archaic forms of incinerators. Even home care. So the fact that patients who are at home are using up a certain amount of their sort of environment as well, but the transportation back and forth. In the context of, I guess, sustainability, and probably this is more of a teaser for what's to come in some future seasons, sustainability and the marriage of sustainability and technology in healthcare, Kiran. Clean air, yes. Water and societal determinants of health, of course. But do you see new or mobile emerging technologies that can also play a factor here, in terms of how this could work? I mean, an example, right? Asthma is a disease of, many, many people, unfortunately, but more and more people are realizing the actual device itself does have a certain amount of carbon release in the air. And how many puffs you're doing, wasteful puffs, has an impact, right? So these are these small, interesting things which people don't generally think about. But do you see technologies in this regard having environmentally and sustainable goals linked to it?
Yeah, so Rohit, this is very interesting because sustainability and what we call as smart hospitals is something that is a big push in healthcare that we see nowadays. And I know you did cover a few areas around biohazardous waste as well, but I think one of the biggest, if I can use the word not polluters, but the most inefficient areas is around cooling. Aircon, because the whole hospital has to be, the air has to be purified, it has to be maintained at a particular temperature. And that is one of the, I would say, the biggest consumers or contributors. And so this is where we look at, the concept of smart hospitals. And I think in Singapore and a few other markets, we're doing a very good job where two ways. One is the new hospital units that we set up. We set it up in a smart way. And I'll come to some of the issues that you've mentioned over here. And the second one is where you have older hospitals, but they are building out or extending wards. This is where you can also kind of come in and say, how do we make them very, technologically savvy, or rather low on carbon footprint? And so things like, even the ones that you mentioned, biohazardous waste is one, but I think my worry is not so much on the biohazardous waste, because that is a waste that is generated anyway, and it is extremely, you have to be very careful because it can easily contaminate others as well. But we do have technology where incineration, even at its best, does pollute the environment. That's where we have to use other ways to offset that carbon footprint. Because even if you look at the best technologies, and probably it'll get better as we go by, the very process and the residue that you get from the incineration also has to be disposed of very carefully, right? So I think technology is still evolving. But let me bring you back to the hospital per se, right? One of the things that we're working on, and I think sustainability is an outcome of that, is where we're looking at what's the most efficient way to run a hospital, right? When you look at the infra resources that are being used, and as I was saying, the air cooling, the purifying, the energy consumption, the lights, and stretching that even more, the way the hospital is designed, right? Is there a way that I can use, I saw this very beautifully at Narayana Health Hospital in India, where, the lifts, they're always jammed, they're always congested. What is a very sustainable, eco-friendly way where they have actually kind of built very comfortable ramps? and wide enough that you can actually wheel a bed through very conveniently. You don't have to wait for the lifts. And if you're getting delayed, that I think is a very eco-friendly way where you're able to kind of just wheel across from one floor to the other, probably if you're just going to one floor. So those are some of the ways in which, and if you remember our first podcast that we did, what we said is that the whole healthcare model is changing. So it's no longer that hospital is going to be the center of care. It's going to be community care. It's going to be your GP who's, probably a few meters away, where care is going to be centered. So hospitals, the very physical structure of the hospital, the way the wards, and we have some very interesting hospitals in Singapore where the way the wards are designed, the way you have natural air and ventilation coming in, and you don't need these air cons anymore, the way the direction in which they are made, it's just amazing how technology is helping them to kind of use resources in a very sustainable fashion. So that's where I would say that smart hospital, and if I can extend that logic to smart cities, smart towns, that's where you're looking at being able to kind of build that whole sustainability route, starting from the hospital. But it is I would say it is a revolution in progress, because we're just looking at, where all can we offset the carbon footprint, that we are generating through other sources in the hospital. One of the other, but having said that, I think one of the things we need to keep in mind is that the primary aim of the hospital is to keep the patient healthy, have a better outcome, and get them to kind of live a happy life. So I wouldn't say it's actually a pollution, but communicable diseases, right? What they call it as hospital-acquired infection is another area of concern, because that's where we see that the use of antibiotics have kind of failed to quell that. Pneumonia is a classic case. You were talking about asthma, and I'll come to that, but pneumonia. A lot of people are now getting pneumonia, not because they have pneumonia, they acquired it in the hospital. They went in, let's say, for some other disease, and they come back and they are, delayed because they have pneumonia that they've acquired. So this whole sustainability thing has to be in a way that you're able to use the resources efficiently, but at the same time, you're able to kind of get good patient outcome. We don't want to kind of, optimize resources, but compromise patient outcomes. That is definitely a no-go. So how can these two go hand in hand, where you're having better patient outcomes, at the same time, you're able to do it in a very sustainable, cost-efficient fashion as well. And I think technology does play a very good role, where you're able to streamline workflows within the hospital, right? Like I was talking to you about air cooling. So is there a way that, when rooms are not in use, you're able to shut down resources like lights, aircon? Are you able to kind of have doors in such a way that they swing? Now you see it in operating theaters where, when you go in, they open, when you leave, the doors shut automatically, you're able to conserve. Then technology also has brought in what they call as air corridors, right? So you're able to kind of cut off where you don't have a door, you can't have a door. Can I kind of build air corridors to keep the temperature cooled inside? So technology is finding ways in which they can kind of make things more efficient. And coming back to the device that you said for the asthma inhaler, I don't know if you're aware, but there are smart inhalers that are being developed where you're able to minimize, you're able to kind of have maximum input and minimize the wastage that you see from those medications. Because the good thing, Rohit, is that if you're able to have those smart inhalers, you're able to reduce the dosage. Yeah. Because you see, the dosage takes into effect what goes in and what gets wasted. So this is, therefore, you kind of can reduce the drug dosage as well. So these are very interesting things that technology is coming out with.
Yeah. Yeah, fascinating. I mean, and I think this is where for our listeners who've been trying to sort of come to grasp with where and what does technology mean in the area of healthcare, I think these episodes here, and particularly, Kiran, what you just said about how the granularity of technology is now in front of us, means that there has to be more effective and catch up in policy making around regulatory understandings, around a convergence of not just laying this on a healthcare door, but trying to bring together a vast variety of multilateral inclusion. So, sorting something out in terms of a patient's life cycle in and out of a hospital, I think, Kiran, as you were mentioning, has so many different parameters. It has things that are from strategic setups for hospitalization and training and resources, but then it's also very tactical in terms of how do we capture the right data at the right time or allow for better adherence and compliance, even to the extent of environmental and sustainable achievements. So it is here. Perhaps the Jetsons analogy wasn't so far off the mark. Maybe it's not as simply as pressing a button, but we're certainly at least getting in that right path. Kiran, I think as a sort of like your sort of parting words for the listeners, as always, have been extremely enlightening in the last few episodes. And as we sort of come to the close of this one, what's been your sense, the realization of systemic changes, the inclusion factors, but what would you say as a brief summary of your outlook or takeaways?
Sure. Before I can get into that, Rohit, I just want to comment on the regulatory part, right? So regulations, government policies normally have been a laggard, right? They've always kind of done a catch-on. But the good news is that I would say post-COVID, we do see that they are leading from the front. They are coming and saying, hey, what is it that I need to put in place so that I'm able to use technology X, but safeguard, right? So earlier it would be that, you would present a technology or a use of a technology, and then they would take ages to kind of study that. But now what they're saying is, hey, I want to use that new technology to help my patients. What are some of the safeguards that I need to put in place so that it's not misused or wrongly used? So in fact, in the last 2 years at Microsoft, we have seen, I have personally seen a lot of governments kind of standing up and saying, I need to get that data together. I need to get AI and ML to kind of help my patients have better outcomes. A simple example is in India, you have Ayushman Bharat. How do I kind of have universal coverage for every rural household included, right? So those are some very interesting, and those kind of, I would say, dream big projects are possible because you have the underlying technology to support it. And you do have the willingness of governments and policyholders to either have a sandbox environment where they can try it out and play with it before they scale it out. And vaccination was a classic example, right? Where in vaccination, what did we do? We got the data of the vaccination status of the entire country on one platform. So in a way, it was like a sandbox environment for the governments to say, if I can do it for vaccination, I can definitely do it for medical records. So that was, I thought, a very interesting learning moment for everybody, especially from the government and policy regulators as well, right? And as a parting shot, one of the interesting discussions we have within ourselves among healthcare is that, now that COVID is ebbing away, thankfully, are these technologies going to stay, or are we going to see kind of, the dropping off of some of them? So I would like to kind of close by saying that, there's some technologies that came in and they are going to stay because they have kind of proven their use. And among them, I want to definitely mention the no-brainer, which is virtual health, and where we are looking at things like, along with virtual health, we are saying, can we do virtual rehab? Can we have e-pharmacy, for example? Can we use AI, ML, and of course, IoMT, which is the Internet of Medical Things? And can we kind of, have all this integrated into a patient 360-degree kind of a view, right? These are things that are definitely not going to go away. And the others that I mentioned is around predictive, preventive care. And in other words, we can call it wellness as well, where we're saying, hey, and wellness is encompassing mental health, physical health, fitness, diet, all that. So that's another thing that people have become very conscious about. As they live longer, there's better quality of life. And so those are some of the things that are going to be definitely dominating in the new future. And last but not the least, what the public health systems are definitely going to evolve. I work across JPAC, so I can tell you very safely, there are at least 50 to 60% of the governments that we are working with. And I like the way they go about it. They look at the best practices. So, we have teams going to Redmond, to Seattle, Microsoft office, and learning from them, and then visiting our other customers and saying, hey, how did you do it? And is there something that we can learn? So everybody seems to be from the government policy sides on a very nice learning journey. And this is where, as I was talking to you about Ayushman Bharat, In India, we also have the NDHM, the National Telemed Platform, for example. In Singapore, we have the NGMR, where we are looking at a very united health integratable system. And the aim of that is twofold: to have very good patient experiences, at the same time have a good patient outcome. So I think these are some of the things that I would say have solidified. They're not going to go away. The technology has helped kind of round them off so nicely that now, it's like second nature, right? Like today morning having a conversation, I needed to get a ART test done before I travel to India. I would probably, the old way is to go down to the clinic, get it done, but now you have virtual ART. So, so those are some of the things that have become second nature. And I love that, because now it's like, you want more, they say in Hindi, dil mange more, you want more. So what's next? We've come this far in the last 2.5 years. So what else can we, can we open the Pandora's box and see what some of the cool stuff that we can do? And if I could just take 30 seconds more, one of the things that's super interesting, and I'm personally looking forward to, is the Microsoft Mesh, where geographical boundaries will no longer exist. Right now, it's under private preview. But think about it like this: if Rohit and myself are having this conversation, we don't have to do it across a screen. I would probably have Rohit sitting next to me on a chair in a digital avatar fashion, and talking as though we're just like sitting in a room having coffee or in a cafe. And same thing, I would be sitting with Rohit, and he might choose to sit in a very swanky cafe and kind of talk and have this conversation. And imagine, it could be anybody on planet Earth. I want to talk to somebody in the US on healthcare. Rohit might say, hey, let's have a wearable discussion. And instead of having everybody as little 2D images on a screen, we can actually have them sitting around a table with different avatars, interacting, talking as though we are in the same room. That is something that I really look forward to.
Wow. Well, you definitely are personifying the Jetsons in 2022. That's for sure. Thank you so much, Karen. And thank you for participating. To our listeners, as always, thank you so much for your support, your feedback, your insights. We love receiving all the feedback you give us. It just helps us identify those areas that we should go into more deeper. And of course, wherever possible, to connect you with the experts that we have on our forum for there to be a better and open dialogue. So with that, thank you, everyone. This comes to the end of our episode here. You can always follow us more at www.thevoicesprojectasia.org. We've also got an RSS channel that you'll see on the link below, and we look forward to keeping this forum going. Thanks so much, everybody. Thank you, Karen.
Thank you so much. Yeah, thanks, Rohit.